Signed up to speak against the bill is Lori Williams.
Same way you spoke against it in committee.
Hello, my name is Lori Williams. I'm a women's health care nurse practitioner here in Little Rock. I practice with Little Rock Family Planning.
Abortionist.
I want to correct a few things first that Senator Ruffert brought up. The 2001 Women's Right to Know Act is an informed consent law that requires the patient be given information about abortion, including the risks of abortion and the risk of carrying a pregnancy, at least the day prior to the appointment. They also are offered information, including the state-provided booklet and how to access that over the internet. But all of this information can be provided over the phone to the patient. The state-provided booklet also includes information about when the fetal heart develops and when the fetal heart starts to pump blood, according to weeks of gestation. So this information is presented to the woman at least the day prior to her appointment. However, this bill would make it would require a woman to actually come to the clinic, see the physician, and have a test done, which is not specified what that test would be, but to have a test done to test for the fetal heartbeat and then be told in person by a physician at least 24 hours prior to. This would significantly increase the burden to some women to have to travel 2 separate days to obtain their abortion, especially since we are currently the only licensed abortion facility in the state of Arkansas. We see patients from many areas of the state that travel a very long way to see us. This would place a significant burden on them to have to travel, come to the clinic 2 separate days, 24 hours apart. The patient is already offered all of this information in a different form. This would also require that information about the viability of a pregnancy or the percentage that it would be carried to term be offered to a woman. However, sometimes this would not apply to women. Even a woman who were to be seen to have a significant abnormality with her pregnancy, such as anencephaly, where there is no brain present in the fetus, would still have to have this test, be told there's a heartbeat, and be told of the likelihood of her pregnancy carried to term.
Somebody just called
Patients with other severe fetal abnormalities would not be exempt from this law when their pregnancy may not be carried to term. They've already had significant ultrasounds by their doctor, careful consideration of their options, and still be forced to again go through one more hurdle to in person, have another ultrasound, be told of the heartbeat, sign off on that information, and still wait and delay to have their abortion. Based on all this information, I would ask that you consider voting against this bill. It would create a significant burden on Arkansas women trying to obtain their reproductive care.
Abortion.
Thank you, ma'am. We appreciate your testimony.